Okay, we are now on, we're on and ready for you, Teresa and Karen.
Okay, ready?
Yes.
I'm
Okay,
always ready.
so hi, welcome everyone. I hope you had a good Thanksgiving. Small and different, but a happy Thanksgiving. And I hope everybody's well. Today we have a guest speaker. But before the guest speaker, I don't know if there are people here that are from 4410 programs, but we should be getting a packet from the MTA with Metro cards for parents that opt out of busing.
Oh, good.
According to the email I just received yesterday, they should be delivered this week. And the ones that we had given parents or that we received expire the end of this month. And the other update is, even though the CDC has changed the quarantine requirements, we're still required to follow the Department of Health 14-day quarantine if someone was in contact with someone that tested positive. So the Department of Health hasn't approved the CDC's limited quarantine. And does anyone else have updates for 4410s or a school age?
Teresa, this is Chris. One thing we got to remind people who are on phones, just to remind people, because you know you're also on the phone as well. Just remind everyone, if you're the phone people, please remind yourself that you are *6 to mute and *6 to unmute. If you're finding out who's muting you, that will be me, because we can't have echoes and noise. We want to make sure our speaker and anyone who's speaking can make sure we can hear you loud and clear. Especially, this is recorded for this meeting. Also, in your panel area, please make sure that you are using your panel, which is in the middle that has a number 10. You can click on that and raise your hand if you have a question. Or you can just, as everyone is doing, which is easier, is to please have to type in your chat what any information you like to put in. There's always ways of making sure we can keep the volume down and make sure everyone listens. Teresa, also, here's the agenda right here.
Okay. Do you have Winnie on the agenda?
Of course.
Oh, yeah, sorry. Okay, so I'd like to introduce Winnie Schiff from IAC. Nice picture. And she's going to speak a little bit about the the virtual lobbying day this week.
Yeah, so, and I also wanted to ask a little bit about what's going on with schools, but so tomorrow at 11 o'clock, and I think I can put the link in the chat. Oh, there it is. Thank you so much.
No problem.
This is a family organized virtual rally. It's statewide, so from Western New York all the way down to Long Island and every place in between, we have people going to speak. So most of the speakers are pre-recorded because we want everything to really run smoothly. So it's going to be little videos that they have done for us. A whole bunch of legislators from, like I said, across the state. Also lots of family members, self-advocates, all going to be talking about the cuts that have been talked about for the last few months, including the residential cut that was effective October 1st and hasn't actually happened yet, but it will happen retroactively unless we can do something about it. The 20% withhold on the family support services. And the governor has told all the state agencies to submit budgets that are 5% under what they spent last year. So we're starting out the new budget with 5% less than, you know, on top of already the cuts that we're fighting. So basically it's to make sure that the governor knows that we get that the state's in a terrible financial situation, but they need to find the savings somewhere else because we don't have it here. our services are really necessary for people to live the kinds of lives that others take for granted. And, you know, as we all know, I know you guys are concerned with school and early intervention. These have been underfunded forever. And now adult services are really getting hit too. COVID, we all know, has been really, really difficult for adult day providers. Kids who are aging out of school right now are finding themselves with virtually nothing and no ability to get evaluations so that they can move into the next phase of life. It's been a terrible, terrible time for all of us. So we hope that you'll join us. And I'm so glad to see that Chris has got the Zoom meeting information there. It's not going to be the kind of thing where you can ask questions or participate. It's more about listening. We'll have a chat so that all questions will be answered eventually, but not during the rally. But it should be really uplifting and terrific. And we also have a lot of pictures of people and great music, and it's going to be fun. So I look forward to seeing you all there.
Winnie, this is Debbie.
Mhm.
Sorry. I've also been feeling to suggest to families, I know how upset we are about cuts and the polls, but I feel that we have to be more positive and not be nasty to the governor and the legislators, even if we don't like, even if we're very upset, because they will then shut down on us completely. Am I correct?
You're absolutely right. Thank you so much, Deborah. So what we want is for the governor to be our hero. As far as the legislators go, they're really all behind us. We have great, great support. And we have a ton of parents who have, you know, kids with developmental disabilities in the legislature. So and lots of them are speaking. So we've got great support, and the governor just needs to realize, you know, he's got this terrible mess of a situation in the state. Not us. No savings here, Governor. Be our hero and keep our services going. And absolutely, you catch more flies with honey. We don't want to be nasty at all.
And that's why I brought that up, because
Thank you.
thought you're welcome, because I've known that when I'm nicer, especially to the staff, like I've been getting a lot more assistance because I've been working with different Congress staff and of course assembly, because it's so important. So I was just glad that you're saying I'm correct, because I've had certain people have said, why are you being so nice? Because I have to make sure, besides you get more flies with honey, you get, he'll remember it more in a positive manner than if we get vicious to it.
And, you know, to join tomorrow at 11, and it's going to only be for an hour and a half. So if you're a little bit late, that's okay, but you're not going to be, you know, we'll be wrapping up by 12:30. I will send an email with the link. So you can do a screenshot of what Chris has got up and type it in yourself, or I'll send the link via email to Deborah and Chris and Teresa, and they can send it out to everybody so that you can just click on the link.
Rennie, just to let you know, I did send this out over the weekend. I will be sending out this afternoon some of the attachment that we have here. I just upgrade a little bit so it make it a little more flavor.
Okay, I'll leave it to you then, Chris. Thank you very much.
Not a problem.
Anytime.
So about early intervention in schools, and I don't know how many of you are people who run programs. So let's start there. How many run early intervention programs? So just say me. All right, how about schools?
Me, Teresa.
Okay, and the rest are family members?
From YI, agency for support.
Okay. All right, great. So I wanted you to know that we have done a recent statewide survey for schools, 4410s and 853s. And I think we're still awaiting the results, but we wanted to find out exactly where schools sit. There's been so many issues, low enrollment, kids out there with nothing, just like the graduates with no day program. Problems with one-to-one aid funding, problems with virtual lessons. So I think once we get that information from the providers across the state, then we're going to be formulating our advocacy plan. And our part of education is a tiny little part, but it's so important for us and for the future of our kids. So we're not going to let it go, as we never do. But this year, we're going to fight like crazy to try to keep our schools going. And we are right now. So if anybody has any thoughts that they'd want to share with me that might help our advocacy, I would appreciate hearing it.
Well, Winnie, it's Teresa. What I'm finding is parents calling me from our graduates of August, the kindergarten children, and they're not getting services if they, meaning related services. So I've had a few parents that have been going for arbitration, and it seems like if they got a placement because they were new into the school, and I guess schools are limited in having public school services, they're not getting their related services. So they're not getting everything they're entitled to.
Okay, so noted, and I'll speak with Chris about it. I'm sure you have.
Yeah, and on a little bit of a positive note, I'm starting to see more kids from EI doing evaluations, and we're starting to get slowly, but starting to get some children from CPSC. I mean, we're down, Chris knows this, and like the other 4410s, I always have a over enrollment by this time of the year.
Exactly.
I'm down to just 2/3 of my normal school. And the other thing that I'm noticing, I don't know if other schools are, but parents are opting to keep their kids in EI because they're getting services at home.
Yep.
Or going to those learning bridge centers, and they're supposed to be getting teachers and therapists coming to those centers. So they're not really getting everything they're entitled to, but they're getting limited services.
Okay, I got it all. Thank you very much for all that. I'm glad the CPSC is starting to refer kids, and I'm glad the evaluations are starting to happen a little bit more. I know that that's the case. You know, every transition requires an evaluation, and it's been clogging up movement for everybody. So that's good.
Yeah, adults, the 20 children that are turning 21, those children that graduated from our high school program, most of them are not in programs like you said. Adult day service has cuts and no enrollment.
Well, a vaccine is on the way.
Yeah, hopefully.
So, anything else for me?
Winnie, it's Sandy.
Yeah.
How
Hi,
are you?
Sandy. Good, thanks.
So what kind of questions are on the survey that you're sending out?
It's been sent, and I don't have it in front of me, but I think I can share the survey with you via email, and I know I have your email.
You do?
I'm pretty positive.
If you don't, Winnie, I can. You can send it to me, and I'll send it to Sandy.
Great, thank you, Chris.
No problem.
Yeah, I've got to get a copy from Chris. Again, this was statewide, and it's really to assess the position of schools, both, you know, census, the number of kids who are actually in seats, and all of the financial issues that accompany having 2/3 of your seats filled. All right.
Thank you, Winnie.
All
Winnie,
right.
Winnie, I have something to add in. Because this was brought in the other day when I actually left today when I was at Queens DD Council. There are some families are a little. I would say there was at least half a dozen parents between Brooklyn and Queens are right now more concerned because the more issue there, I'm seeing the stress level going around is why schools were closed during the coronavirus. Second, it's amazing that our council member, Mark Traeger, which technically he lives in my district here, and well, and at least, we're all under his skin, but the mayor is forgetting to worry about he worries about regular ed, but nothing with special ed or District 75, because I know, in fact, even Mary Christopher is like, I can see from her and everyone else is frustrated with all these issues too. And a lot of the families right now are upset, or they're like saying, well, I'm just going to teach my child to learn from a computer. And I'm seeing that even in our borough for the last couple of days, even before Thanksgiving.
So we still have to follow the yellow, orange, and red zone guidelines, but District 75 is opening on Thursday this week.
Yeah.
So this is very good news. And I know that our 4410s have been kept open because they are regarded as childcare centers, even though they are actually schools. And Chris is doing a lot of work on that. But, I guess our 853s are subject to the same rules that the District 75 schools are. And, like I said, the orange and red school closure zones, now there's a way to reopen, with the testing. So I know that 14-day quarantine is still required by DOH, but I guess things are looking up, and they are really realizing that schools are some of the safest places for anybody to be, and that the transmission among kids has been quite low. And by the way, that's the same in adult programs, if any of you are worried about that. We're constantly monitoring the infection rate and expected a big bump after Thanksgiving, and we're not seeing it. So it's a testament to how careful we're being in our schools and programs, and also how careful our families and staff are being. So let's hope that it continues through our ability to get the vaccine going.
Yeah, the vaccine is one thing, but also some of them who can also still take the flu shot, please make sure you see your medical doctor, because that's what they've been saying.
And actually, that's required by kids in school, right?
Yes.
4410.
Yeah. So, okay. So that's it for me, but thank you so much, you guys, and I look forward to seeing you all tomorrow at 11. Any last parting words?
I know we had someone just came in. I know we have phone people. Does anyone on the phone have any questions? Have any questions for Winnie?
No, thank you.
Thank you,
No,
Winnie.
thank you.
All right. Thanks,
Much
everybody.
appreciated. It's very important information. We have to keep reminding people that we have to advocate and our voices have to be heard.
Absolutely. And I know that Chris is meeting with Mark Traeger. I'm not sure exactly when, but he keeps a regular contact with him, and we'll see what happens.
And I keep
I'm
contacting
hoping
him on
that
Facebook.
if my parents attend, I've sent them this flyer.
Good.
Hopefully.
Great. It's really it's by families and for families. So all families are welcome.
Thank you.
All right.
More the merrier.
Bye-bye. Thank you.
Winnie, we'll see you
Bye.
tomorrow. And
Excellent.
Sure.
Carrie, do you want to give an update?
Carrie, you're on mute.
Yeah, I know. I was working on it. Takes a minute. Well, as you know, in terms of libraries, I think as people may be seeing, they're opening and closing depending on, positive testing rates in communities. So, for example, Kings Highway is closed. We're looking to reopen it soon. So you just need to, go in and check each branch on the web before you actually go there, or give a call. Sometimes we also close branches when we have a staff member who tests positive. And to be honest, we have staff shortages too, because we're working on smaller staff. So it's a good idea to continually check that. On the other hand, you can count on our virtual programs. And I've put a bunch of them in the chat for the end of the month and going into January. I pay particular attention to who's DeRoma and Include NYC's program still on the first Wednesday of every month, but navigating disability systems. It's a phone-in program, so people can come even if they don't have access to the internet. They just call me and make an appointment. The information's all in the chat, and I will send it to Chris so he can put it up on the website later on. We've got some gardening programs up and running, which we're excited about too. Garden Adventures once a month. And again, the solid information's on the chat, but I will let you know, just a heads up, we will be potting the beans that we started 2 months ago that have been sprouting in a jar since then. So it's kind of exciting time for us. And then we actually should have some beans to eat probably certainly by February, but maybe even at the end of January. So check it out at Garden Adventures. It's on the Brooklyn Public Library's family Facebook page. And apart from that, Teresa, we're going to talk about a program topic for January, right?
Yes.
Okay, cool. So I'll just leave that. And if anybody has questions or they need more information about the library, I'll put my information in chat again, though I think most of you know how to get in touch with me. And of course, Chris always knows how to get in touch with me.
Especially I can go somewhere the other end of the B68 route.
There you go. Thanks all. Questions? Any questions about library services?
Very quiet today.
It's cold.
Yeah, we had our first snow flurries
On Staten Island?
in Brooklyn.
Oh, in Brooklyn. I didn't see them.
Oh, when, Teresa?
Well, I left my house at 10 after 7, so that was near Kings Highway, Midwood, and all the way to Williamsburg. Nothing sticking, just
Oh, wow.
very light snowflakes.
I'm sort of happy to report no snowflakes in Windsor Terrace yet.
Snow is very pretty, but in the country, not in Brooklyn. I guess we should talk about some of the topics that we were thinking about. And Scott, I don't think he's on, but Scott Nash had agreed to do some topics for us. He had suggested a topic on recognizing, what was it? Autism, the signs of autism and developmental delays. And the other one was how to navigate through the early childhood, meaning EI, CPSC, and CSE system. Is there anyone on that can think of other topics that they think are needed or that families have asked for?
A lot of the issues that we're seeing are around devices, getting devices, having connectivity and things like that. But with the shift to in-person learning, I think that we could dial that back a little bit for now. For the younger kids, I mean, for the older kids, it's still an issue. So I'm just throwing it out there. But that's maybe part of the navigating thing. Would he cover that in there?
Yeah, we could add that. I know that there's a website that we've helped parents get on and apply for the iPads. So far, we had 2 parents that received the iPads, but they applied in May. And according to the Department of Education, they're behind in iPads. They're waiting for shipments.
There's also been some
Moped?
inequalities around the way that they're given out. So there was an entire school in East New York that told their students they wouldn't be getting iPads, essentially. No mobile devices, because they hadn't gotten any and weren't expecting to. So I think that there's a lot going on with the iPads that's just kind of below the surface, and we're not really seeing as much. So it's not just a question of them not having it. It's a question of how they're allocating them.
Yeah, they're saying they're
Agreed.
giving to children in shelters first. I know that last year we had a child in the shelter that received an iPad,
Great.
but they gave 2 iPads to the family. There were 4 children, and
Mhm.
2 of them were school age, 2 were preschool. So they had to share the iPad, but the shelter didn't have Wi-Fi, so
Right.
the iPads were useless.
Right. That's another huge issue. And I would just say about that the libraries are expanding. We are expanding the coverage of our Wi-Fi in neighborhoods. So, you could always go and hang out on the steps of a library and catch Wi-Fi, but now you should be able to do it in a larger, for some of the libraries, in a larger zone around them, like a full square block. So, and more in some areas. There's more information about that on the website. It's not ideal in winter to have to go out and to access Wi-Fi, but to be honest, it's the best we can do, and it is something, I think.
Excuse me, this is Chris. One thing that, Teresa, and I think I mentioned this to you last month, Moped also, needs to know this too, because they deal with the, a lot of our population, because the only thing I'm a little disappointed with our school, or the Department of Ed, is, I'm glad they're doing shelters, but also at the same time, they also almost forgotten special ed students too.
Chris, I raised that at the last mayor's office for people with disabilities meeting.
Yeah, and I backed you up.
Yeah, and you did. And I don't, nobody from the office responded, but I'm hoping that there'll be somebody there the next time to talk about it. Maybe you could drop that in again and reinforce the message.
I think maybe we should invite Jonathan Nowak or someone from his office to come to one of these meetings, because, I'm glad we can still get free Wi-Fi still available on their website.
Mm-hmm.
But going with tablets and stuff, it's just, we gotta, really wake them up and say, well, guys, right now they're gonna say, oh, the Department of Ed goes like,
yeah,
and they're not looking at the student's IEP.
Mm-hmm.
That's the thing they're forgetting. A lot of the students, some families who are regular ed may already have a computer or an laptop. They just need a simple tablet that can handle the Wi-Fi and making sure they can do their classworks the best they can.
Yeah, Wi-Fi access is a big deal. Teresa, that's a great idea. Why don't we invite them for the next meeting?
Okay. You'll give me their contact information, Chris?
Yeah, I'll email it.
I can reach out.
Mm-hmm.
Yeah, I can reach out to
Okay.
Jonathan.
Okay.
Thank you, Gary.
Sure. I think either one of those topics or both would be great. Building an audience for the autism one might be a little more difficult because we have to reach out to people who are not already connected with systems. But, we can do some of that through the library, and it's still useful to get it out through the schools and those and this network too. So, and if we do it enough in advance, I can do a mailing and get it out to gen ed schools too.
Okay.
And maybe we can also forward it up to a lot of the families, like, we can forward this to the family, because I know I send out the email to remind them all.
Yeah.
And I think, Carrie, if your list on the library end should also remind them there's a children's committee, that's another way of them, letting them know to come so we can hear more to this meeting more.
Right. No, that's a good idea.
Yeah.
And my main concern about that topic is because the people that we're talking to already are connected with developmental disability systems somehow and have a diagnosis. But that workshop on identifying autism would be targeting families that are not already connected to the system, don't already have a diagnosis. So my concern is reaching them. But if we have enough lead time, and by that I mean like at least 8 weeks, more like 12, we can get a sort of larger publicity machine going for it.
I'll email Scott and, copy you. We could
Right.
figure out, once we figure out a time, so maybe we can figure out a date in March. That should give more than 12 weeks, right?
Yeah, March is good. Late February would probably be all right, depending on the school break schedules. At least we don't have to worry about people not showing up because of snow.
Yeah. See, there's a positive to everything.
Right? And leave it to me to find it.
I actually, the two things that have been positive about all the Zoom and remote
Mhm.
is that parents, especially with children on the spectrum using ABA methodology,
Yeah. Mhm.
are learning how to use it. We used to have them come in once a week, but having to work with their child, we're seeing a lot of progress because it's being done at home too. And the other thing is that we can get in touch with parents.
Mhm.
They're checking their emails and they're responding, where in past, you didn't always have that. So I always try to look for the positive in things. Is there anything else from anyone else? I'm trying to look to see who's here.
Yeah, you can look at your panel, but the only thing is you have at least, 10 people.
Sandra, do you have an update with ADAPT, with what workshops they're doing and trainings?
Sandy?
They're doing all hybrid in all the schools. I know that. And Family Connect is actually offering free webinars for the parents. Only within our schools, though. We haven't offered it to the public yet. So the last webinar was about creating a routine at home.
Nice.
And the next one that we're having tomorrow is going to be meeting sensory needs. So that's going to be available to all the preschools.
Meeting sensory needs?
Yes, meeting sensory needs. So they're going to learn how to make sure that the child's sensory needs are met at home. That's what they're going to be talking about.
Nice.
Same.
So hopefully we're going to be expanding this to the public in the future. But for now, we're just keeping it in-house.
How many schools does ADAPT have now?
11 preschools plus a school age program.
Sandy, I'm happy to get the word out about your programs when they go public again, if I have enough advance notice.
Oh, definitely. Oh, believe me, you'll be the first to know.
I
Cool.
don't think we have to worry, because when Sandy sends it out, she sends it out like
Right.
Everybody gets it.
the whole kitchen, the whole sink comes
The
out.
world knows.
No, only San Francisco bridge. You send it out the whole bridge list.
I haven't heard from, we used to get a lot of information from YAI, but
They're here.
I haven't
They're,
seen anything from them.
Teresa, this is Chris. They're here. She's here.
Hi, I'm here from.
Somebody's here.
Yeah.
I can share information. What are you looking to hear from us about?
Oh, we used to get flyers that we shared with trainings that didn't, well, I don't know if you're providing them, but trainings, workshops, your medical facilities. We always used to share that at the Children's Committee.
Yeah, we're going to be
At that
having.
time, someone used to come, I can't remember her name, but Claire and Shelley were New York League was attached to YAI, so we used to get a lot of YAI representation.
Yeah, we unfortunately are not affiliated with them anymore, so we're not as involved in like early childhood services, but we definitely still do clinical services. We have some group programming, respite, and all of those kind of services. So we're going to have someone from YI coming to represent moving forward. So we're happy to share. I don't know if you want flyers shared through email or what way, so just let us know and we can always share that.
Emily,
Okay.
this is Carrie Banks. I work at the Brooklyn Public Library. I run
Yes.
our, yeah, okay.
Yes.
So yeah, flyers would be great. Through email would be great. And for people on the phone, I just want to read out Emily's chat. It says call YAI link at 212-273-6182 or link at yai.org for more information about psychological and autism evaluations in person and psychosocial evals through telehealth for people with Medicaid and without Medicaid through a free grant evaluation, free evaluation grant. Also available are living skills programs for 18 and up, ballet, yoga, and social skills programs for people with autism 4 to 12. I have to say the social skills program in Brooklyn is that they've done for the kids. I haven't been there in a while, but it was really great. It was a really nice program.
Thank you. Yes, we're doing that through Zoom.
Okay.
We intend to continue that starting in January. We'll have a new session of that, and it's been going really well. Children are, adapting to that format. It's a little bit different because we do a ballet, yoga, and dance, so it's different at home, but they still enjoy it. It gives them a break from sitting and staring at the screen, so they really like getting out of their seats and following along with the movements that we do.
Nice. Can I come?
Yeah.
Do some movements.
We all need it.
Right. But I am happy to come and talk about the library and virtual library programs with the parents if you'd like.
Oh, thank you. Yes, we can talk about that.
Okay. My
Right.
email's in the chat if you don't already have
Yes.
I can mention one thing about what's going on with the DD Council because, part of it right now, I do have somewhere I'll report, but also I know Debbie has an update as well, Teresa.
Okay.
Well,
First of all,
so-
go ahead.
okay. First of all, the statewide is still advocating very hard to stop the 20% cuts to family support programs. I'm having a little issue with my voice. Can you give me 1 second, please?
Right now, as she's mentioning about statewide from Albany, there's
I'm
movement.
going to also read you the COVID report that we get from the statewide. It's it does update us on what's going on. We do when we have our meetings every few months, we do discuss the issues that have been happening with the across the states. The whole statewide is participating in tomorrow's virtual, rally. And sorry about this. I was out for the moment. Okay. All right. Okay, I got it. So sorry. Okay. As of November 26, 4,391 individuals were confirmed positive, including the 3,414 certified residents. Sadly, 486 individuals passed away with the same demographic trend as previous. And we have 5,675 staff confirmed positive. As of December 2nd, 4,603 individuals were confirmed positive, including 3,574 in certified residents. Sadly, 488 individuals passed away with the same demographic trends as previous, and 5,962 it actually went down for staff that was confirmed positive. But they find that confirmed cases are increasing, So we're all supposed to follow the CDC guidelines, and they will let us know when we have to do more stricter, how do I say, shelter in place. And they also have not made a decision about vaccines because most people with developmental disability cannot give consent. And we have to make sure that the legal guardians are spoken with so that because we don't want have any problems. So this is the latest that I received from Margaret Puddington. She's the chair of the statewide. So I hope everybody is practicing social distancing, wearing face masks when we're outside. And if we hear anything else, we will let you know. Okay?
Does anyone have questions for Debbie?
This is Carrie. I do.
Yes.
It was a lot of writing down and I got lost. Can you send those statistics to me? Can you email them to me?
Sure. I'll do it later.
Thank you. I'd really appreciate that. I'm sorry I don't write faster.
That's okay. Okay, the other thing I just want everyone to know that, this is a report from the state across, because there's 19 councils across the state. So it's not where it's just New York City, it's the whole state we're reporting. Nothing has been broken down into like in Brooklyn got maybe 500 or Manhattan got 300. No, this is all the whole state with individuals with developmental disabilities, staff, and we're just praying that nobody else gets sick, and we also are hoping the vaccine will soon be allowed to be used for our individuals with developmental disabilities, because some of them do have pre-existing conditions, and also as I said before, not everybody has a legal guardian, and not everybody's able to make a medical decision like that. So there's a lot there discussing, which I'm not going to be privy to at the moment because even though I am on the statewide, I am not the chair. So I'm waiting for Margaret Puddington to let the rest of us know what has been decided about the vaccine. So.
And just to add one thing to everyone, and Carrie, your information that I got from last week is already on our website. Please make sure that, this is also good for Teresa as well and for everyone. We also been adding some new features, new stuff also on our website to deal with coronavirus stations, because now they've been adding more stations to where the coronavirus stations are. Also, it's also adding food bank stations are also been added a lot of times. But also, please check with your elected officials, because sometimes they do give out food as well. And I have to say, a lot of people did that during Thanksgiving, and the holidays are coming around the corner. Hanukkah is coming soon, quicker than we think. Also, how to keep yourself busy is also been updated with a lot of new stuff too. So please make sure that when you visit our website, you also will see the Children's Committee meeting schedule. You will see the guidebook is still there until the new one comes out. The committees, and as I said, prepare for Corona-19. Every information is there. Just visit our website.
Also, there's a few more things I want to bring up. Reference with the COVID, with the food. If you have families that are having trouble getting food or going out because the parent could be a senior, contact 311 and either through phone, email, and ask to be put on the New York City food program. Specify if you need. They do recognize kosher and halal. And what is that twice a week they bring you a few meals that can last for a couple of days with fruit, and it does help a lot. Also, all the elected officials, this is the time when they also are been giving out food, as well as if you're a member of a political party, doesn't matter, Republican, Democrat, contact them. Also, if you need you need the face mask, shields, gloves, contact the elected officials
more-
too. You can contact 311. You can also add moped in, but it's really important. If you need the help of the families, please contact 311 and the elected officials so you can get the equipment and the help you need.
Also, just to add one thing, Maria Mark is giving, if a limited time right now, is giving out face shields. If anyone is interested for face shields, please let me know so I can then let Maria Mark know, and she will make sure that arrangement is. It's first come, first serve, and right now she has mentioned this to the disability community first. Face shields, you have a choice because there are some families cannot always wear a washable mask.
I'll go get you.
The main thing is to please let me know. The mayor, she represents the mayor's office of community affairs, and if we ever want her to come to a meeting for the children, because remember she has a child similar same age, but she is a good advocate arsenal weaponry as well. The mayor's office of community affairs. She has attended our general meetings, and I think she will be attending the next one. As vice chair of the Brooklyn DD Council, just to let everyone know, our next DD Council meeting, which I'm going to shrink this screen a little, there we go. The next meeting is it'll be Wednesday, December 16th. We are discussing the meeting. We are discussing the plans for 2021. We are making sure that everyone, please try to attend the meeting. If you know any families who need any questions or need something, they can reach us. Again, this is the next joint meeting, which will be Wednesday, December 16th. The meeting ID number has not changed. It's been the same one since September. So please make sure everyone you get that. The minutes will be sent out by closer to the end of this week, and reminding you to make sure you're on the Ring Central. You can come on by 9:30. The meeting will start 5 minutes early to remind everyone to follow the instructions and make sure all your devices are working as well. As a reminder, as no Winnie mentioned about budget, we also got to remind everyone to please try to attend the Zoom page, which is the MTA's public hearing. As you know, MTA is also feeling this effect because of the budget. We need everyone to please try to attend or speak. There was one yesterday on the 7th. There was one as we speak right now. I think that by now that one's over. But their next one is tomorrow at 5:30. You can go on to the website called newmta.info. It's right up here on the blue. Transition Fairs and Tolls of 2020. It is scroll it down on the website, and you can get on the Zoom page. You can register to speak and put your you can put your comment on their email as well. And that's all I have at this time. But I remind everyone, please make sure you wear face masks in the subway or the bus or face shield. As Debbie's wearing her face shield,
It's really easy to get on.
easy to put on. As you see, she's wearing it. Persons who have severe asthma does not also have to wear a face mask and a face shield because that's overkilling yourself. Please make sure if anyone you know has severe asthma or may have trouble breathing in a mask, face shields are allowed. And if you're an asthmatic, always carry your asthma pump with you at all times.
I also will tell you that people who have hearing disabilities, I'm going to take this off now.
Yeah.
But people who have hearing disabilities and need to read lips, this is excellent.
Yeah.
Because honestly, also I carry one so that if I start having an asthma attack, I put that over me, pull the mask down, and start using my treatments. And this way they can't say I'm getting them infected, but at the same time, I'm breathing. This was approved by my doctors. And it's a big help. And I've noticed that individuals who do not like the mask on their face have found the shield very helpful.
Does anyone have any questions for the Brooklyn DD Council? We're just remind everyone, Joyce will be doing partial of the Legislative Committee meeting a little bit during the general meeting. So if anyone is interested for the Legislative Committee, please make sure you email joyce.levens@heartshare.org.
Hi, this is Carrie. I'm sorry, but I have to go. Teresa, is there anything else you need from me today?
No, I think that's it. Thank you.
All right.
Teresa,
Thank you.
Dolores had wanted to say something.
Okay.
Bye,
Yeah,
Carrie.
I just want to let everybody know that NICID, New York State Institute on Disability, has openings for evaluations. I put the information in the chat. I do want to say these evaluations are remote, and we have seen that some families say, oh, you know, I'm going to wait till you could do it in person. And I just want to tell families and let my teammates here know that don't wait. Do it remotely, because then you start the process and you can get the services you need. The remote evaluations are effective. There are people, very qualified people doing them. Yes, it's better to be in person for certain populations. We understand that, but the evaluations done remotely are now accepted by OPWDD. And as long as they're accepting these remote evaluations, that means your evaluation, the family will have the evaluation done and they could proceed to get the services that they need from OPWDD. I wanted to mention that. I also want to say that we also have openings for our crisis management services. These are for individuals that already have OPWD eligibility. We're still doing reimbursement, and we're still doing transportation for medical appointments, and we still have tickets, recreation outings for outdoor events that are okayed by the CDC. So I put the contact info in the chat. Our general contact is info@nicidinc.org, info@nysidinc.org. Thank you.
Thank you, Doris. And yes, I
Thank
do
you.
agree with you, because you see, it's very important. A lot of times the parents don't realize and understand
Right,
that to be qualified to say you have a developmental ability, it doesn't come right away. The testing has to be done, and even if it's done remotely, it's just as important, because if you delay, then you're not going to get the services until a year or two from now.
right, exactly.
Parents don't want to
Get that process.
understand that.
You got to keep that process moving. You got to
Correct.
keep the process
And they
moving.
they cannot use what they're doing at school. The school, your IEP, whether it's for preschool, regular school, that's for your school life. What you're doing with what NICED is doing is for you to get OPW service.
OPWD. Exactly.
It's so that you can have services for life. This is not the same. So YI does virtual, NICED does virtual, any of the agencies that can do virtual, take advantage. Please explain to the families. They really have to understand that you can't call me up and say, or email me, oh, you have to hurry up and get me through. I cannot. If I want my own son to get help or services, I have to follow through with regular updates and retesting. And if he was just starting out, I would have to go through the whole thing virtually if I have to now. So please let all those families understand that even if it's remote, it has to be done now.
Right. Thank you.
You're welcome, sir.
Thank you.
You're welcome, Teresa. Anybody else?
Okay.
Teresa, anything else?
Anyone else?
I don't know.
Everyone's been a little quiet on those phones.
Oh,
Let me-
I have something to
You do, Sandy?
Go ahead,
Okay,
Sandy.
say.
Sandy.
I just
Hi.
want to remind people that. Hi. I just
What?
want to remind people that ADAPT is still doing family reimbursement, and that we're still offering home modifications. So they can speak to our Project Connect or email Project Connect, and I put that information on the chat.
Thank you, Sandy.
Home adoptions and what
You're
was
very
the other?
welcome.
Say that again?
Reimbursement.
Family
Reimbursement.
reimbursements.
She's putting it in the chat, Teresa.
Or
Okay.
she already did.
Yes, so
Yeah.
in the chat. So we offer it in all boroughs except Queens.
Okay.
No problem.
Anyone else?
Teresa, before we do end, I do have the next meeting date on the screen as well.
Okay.
So before
So
we do that, we do have phone. We have at least 2 people. I think 1 person on the phone. Does she have any questions or announcement? Hello, 347.
No. Good morning to all. I do not have any questions. Thank you so much. I'm
You are?
And
here representing Senator Prasad's office.
Oh,
Why, hello.
oh, hello, Prasad again.
Hi.
Can you please, is she going to be, she'll be participating and seeing what our families are saying tomorrow for the rally? I know she supports
not-
100%, but like,
I cannot answer that. I really don't know. I'm working from home today.
oh, that's a good reason.
I really don't know. I would have to reach out to her.
Okay, just want you to know, because we know she's one of our biggest champions, and thank her for all her help, and also
Will
your
do.
help too. We appreciate it. Thank you.
Will do.
Thank you.
You're very welcome. Will do.
No problem. Anybody else?
Anyone else before,
Let's see.
Teresa, you want to mention the next meeting date?
Okay, so the next date is January 12th at 10 o'clock.
Same code, people. Same meeting ID
Thank
number.
you, and have a happy holiday.
You too. And
Happy,
and-
healthy.
Yes, yes.
And please, everyone, please pass the information out to, please get parents. And if anyone bumps into a CCO, please tell them to please try to attend this Children's Committee meeting. Hope to see everyone at the next general meeting next week on the 16th.
Bye-bye.
Bye,
Bye.
everybody. Thank you.
Bye, thank you.